The Nelson Pulse Centre is a province-wide initiative to bring together health data to improve care for all Albertans. Right now, there are disconnected banks of health information across Alberta. Things like diagnostic scans, lab results, prescriptions, and hospital visits are information about our lifestyle and how we access care. The Nelson Pulse Centre at the University of Calgary's Cumming School of Medicine will securely link diagnostic scans and other health information and make it all anonymous so you can't identify anybody. This superbank will enable research and be structured in a way that makes it easy to apply AI and other tools to turn the data into action. Alberta researchers, health administrators, doctors, and nurses can start uncovering patterns and trends in the data to show what treatments work best for different people, or model how they might respond to a treatment. The Nelson Pulse Centre will work closely with healthcare providers to help them bring this improved care to patients.
It is exciting. It is exciting for the future. And it's exciting now because it's already turning returns now for patients. It was my medical experience that came about from my work at Alberta Children's Hospital. It made me so aware of the importance of James's team's work. Secondly, we were really learned so much when I got this autoimmune disease of inflammatory myositis, because it started to show us exactly the advantages of connecting with other medical facilities. Third, it was the fact that I had a very interesting background in high tech and also in artificial intelligence.
Obviously, everybody's disease impacts them as well. And if we can cut through to helping them understand and also getting them solutions, I think this is a tremendous leap forward.
Susan's generosity and shared vision in the Nelson Pulse Centre is critical to its success. It's an ambitious goal to be able to bridge health data resources from an entire province and be able to bring them together for innovation. And we want to make sure that all faculties and institutions gain access to this information to maximize its value. The more I get to know Susan, the more I realize how she's a leader and an innovator herself. And so we work together to be able to bring these ideas to life, and she really brings a great deal of insight into how to do that.
I'm Andreas Stouter. I'm a patient with a genetic heart disease, and I now study genetic disease as well. There were always signs. I used to go skiing and find myself a lot more tired than my family after the first couple of runs of the day. But it wasn't actually until I was 14 that there was anything that seemed worth investigating. I started having some small faints at school. We now know is X-linked dilated cardiomyopathy. Cardiomyopathy is any disease where the muscles of your heart are affected. So it's not pumping well enough, it's not squeezing due to scarring around it, anything like that. Between walking my dog, walking to the bus, taking my meds, there's a lot of things that I can do in my daily life that make it a lot easier to still live a full life. And we have more than blood tests, we have more than genetic testing. We have all of these different pieces of the puzzle together that give us really specific looks and understandings of what disease looks like for you and how that is different from other people.
We're just hitting the ground running to take advantage of that information.
It gave us a great feeling of happiness in making the donation.
Susan's gift is going to mean that future patients will have diagnoses faster, get treatment that is better for them, and get it earlier. So these life-saving years can actually be given back to them and give them and their families a brighter future ahead.